So you're a healthcare product manager. You survived the pandemic, the EHR rollouts, and the executive pivots. But here's the uncomfortable question for you today. Are you and your skills actually ready for 2026? Because the healthcare product management role is changing and evolving faster than ever. AI is writing clinical notes, the FDA just dropped new digital health guidelines, and your stakeholders, well, they now include data scientists, compliance lawyers, and your patients' advocacy groups, all sometimes in the same meeting. So in this video, I'm going to break down the top 3 skills that will separate elite healthcare product managers in 2026, backed by real trends, real tactics, and the right information that you could use right now. So let's get into it. Hi, I'm Jennifer Rist. I'm a senior global platform leader at a leading healthcare tech company. If you're a healthcare product manager, you're an aspiring product manager, or a product leader in digital health, EHR, medtech, or health insurance, this video is 100% for you. Hit subscribe because I drop healthcare product management tips, content, and strategies right here each and every week. So in this video, here's what we're going to cover today. Number 1, AI machine learning fluency. Number 2 is regulatory intelligence. Number 3 is stakeholder management for the modern healthcare environment, plus a bonus at the end. So stay to the end and find out more. Let's start with AI. And I want to be really clear here. I am not saying that you need to become a data scientist or an AI expert by any means. You don't need to write Python or train models, but what you do need is what I call AI fluency, which is most important. AI fluency means that you can look at an AI feature proposal and ask the right questions. Maybe things like, what data is this model trained on? Is there demographic bias in the training set? What is the false negative rates? Because in healthcare, a misdiagnosis can cost a life. And what happens when the model is wrong? And who is responsible and accountable? In 2026, healthcare product managers who can bridge the gap between data science teams and clinical stakeholders, they are going to be gold. You are the translator. The physician doesn't want to hear about F1 scores, but they do want to know, will this flag or reduce my patient's readmission risk? So they want to know, what is it going to do for them, right? So here's your action step. You want to get familiar with at least 3 AI use cases in your domain. So things that you're already working on. So keep it simple. And it's also expanding your skill set in your current role. Whether that's clinical decision support, prior authorization automation, or patient risk stratification, know how they will work at a conceptual level and know the implications, the limitations when things go wrong. That is the bar in 2026. 72% of health system leaders, they plan to expand their AI tools by the end of 2026. And this comes from HIMSS 2025 report. So HIMSS is already reporting, be prepared, because 72%, that's a big number, right? Healthcare product managers who don't understand AI will be managing yesterday's products. And you don't want to be one of those people, do you? So let's now talk about skill number 2, which is a regulatory intelligence. And many product managers outside of healthcare completely underestimate this. And inside healthcare, most product managers, they know just enough to be dangerous, I guess I would say. In 2026, these regulatory areas are critical, even more so, hypercritical. The FDA is evolving a framework for AI-enabled software as a medical device, or as they're calling it, SAMD. If your product touches clinical decision-making, this affects you directly and your products. So the FDA is moving toward a total product lifecycle approach, meaning that your roadmap needs to account for ongoing post-market regulatory activity. This isn't a launch checkbox. It is a continuous process. Also, HIPAA and data privacy is getting more ingrained, especially with the rise of AI features that ingest PHI, or that patient health information. More state-level healthcare data laws are coming. They are coming as well. So we not only have FDA, but they're also going to come state by state as well. Your job as a product manager is to make sure that privacy is baked into your product design, not boiled on the end or not forgotten and saying oops, because you will suffer consequences. I know there's always consequences to all this stuff, right? Privacy by design isn't an ethical principle. It's a competitive differentiator. And our customers are asking these questions when you get into, especially into the sale of your product, right? We have all of these privacy and security reviews, and also, with cybersecurity. So they're asking all of these very intricate questions. And if you don't meet the mark, you're not getting in. So it will cause failure of sales in your product. And there's also CMS reimbursement policies. I know it's not the sexiest topic, but if your product is a digital therapeutic, a remote monitoring tool, or anything touching value-based care, you have to understand how CMS codes and reimbursement works. Products that don't align with reimbursement pathways die. They totally die in procurement, no matter how good they are, because if hospitals cannot get reimbursed for them, they will not add them. So an action step might be to subscribe to the FDA MedTech newsletters and CMS updates, block 1 hour per month to review changes, build a relationship with your regulatory and legal team. I know we haven't had to do that in the past, and sometimes it's painful, but they need to become your best friends. Make them your product ally, not just with your compliance area being a gatekeeper in the end when you're ready to launch a product. Get them involved early so you're doing all of the right things. That shift changes everything. And when we look at a third skill here, we want to look at advanced stakeholder management. So stakeholder management is not new, but in healthcare in 2026, the stakeholder map has completely transformed. And if you're using the same approach that you used even a few years ago, you are already behind. Let me paint the picture here. You're building a patient engagement platform, for instance. You are working with your stakeholders that now include the CMO who cares about clinical outcomes, the CFO who needs the return on investment model, right? The compliance officer who wants an audit trail, the IT security team running zero trust reviews, a patient advisory council, and a data science team that's demanding API access. All of these people have a veto power in different ways. So you need to be able to satisfy all of them, which can sound overwhelming and scary, but it is what it is. The elite healthcare product managers in 2026, they master what I call the 3-layer stakeholder model. Layer number 1 is know your primary metric. Every stakeholder has one North Star. For the CMO, it is outcomes. For the CFO, it is cost per outcome. For the compliance, it's risk exposure. Speak their language. You need to know the lingo. You need to know the verbiage. That will get you far if they feel like you are understanding what they are saying. So layer number 2 would be you want to map their influence versus the urgency. So high influence, low urgency stakeholders like your hospital board, they need to be educated and proactively. Low influence or those high urgency stakeholders like your end user nurse, they need rapid feedback and real advocacy from you. Don't ignore them. Make them your friends. They will get you far. They will make or break your adoption. Layer number 3 is anticipate stakeholder conflict before it happens. In healthcare, physician autonomy versus administrative efficiency is a constant tension. Your job as a product manager is to design products that they respect in both directions. The product manager who can navigate that tension is the one that will get promoted and their products will go far with your customers because you are listening to them. So anticipate this conflict and be prepared for it and be able to speak to them in a way that they feel like they're included. An action tip here could be create a living stakeholder registry for every product that you have. This can help you out a ton, just to give you some key reminders on who's doing what, who's focusing on what, and sometimes things get overwhelming and your brain just shuts down. So sometimes having this as a quick grab can really help. Update it quarterly. Note each stakeholder's current concerns, their upcoming priorities, and any recent organizational changes. This isn't just project management, it's political intelligence. And these days, even if you're not at the sales level and you're at the product level, when you're dealing with customers, you need to know who's who at the customer site and the customer level. It's becoming that ingrained that you are actually becoming part of their internal team. Here's a bonus insight. And this is the thing that separates good healthcare product managers from great ones. It's not mastering each skill in isolation. It's being able to integrate all three in a single conversation. So imagine you're in a roadmap review. Your AI team wants to build a predictive sepsis tool. Here's how 2026 elite product managers show up. That you ask about the model's bias testing in certain populations. That's AI fluency. So you're asking all of the right questions, right? Things that we talked about earlier in this video or on some other videos. You want to be asking the right questions. And maybe you flag something that likely qualifies or quantifies the device as being an SAMMD that needs an FDA pre-submission review. So that is your regulatory intelligence arm. And maybe you proactively loop in customers that you may be partnering with to get input from maybe the ICU nursing director, the CMO, into the discovery phase. That's stakeholder management. One feature, 3 skills, real value. So get your customers involved, especially those that are willing to do beta trials or being involved in development. They will help you and guide you on what's important to them, which 90% of the time, what's important to them will be important to a lot of other stakeholders and customers that you serve. In 2026, the healthcare product management executive or the product manager who wins is the one who speaks AI without being a data scientist, someone who navigates regulation without being a lawyer and manages a complex stakeholder web without losing your mind. Even though daily, I feel like at a product management level, we're always feeling like we're losing our minds. So here are the 3 action steps. 1, identify one AI use case in your product area and study it this week. 2, find out if your products touch any FDA, SAMD guidelines and schedule 30 minutes with your regulatory team. 3, update your stakeholder registry today and identify one stakeholder that you have been underserving. So if this was helpful, drop a like, subscribe, share it. If it genuinely helped, please help get the channel some reach in the product management space and subscribe for weekly content on healthcare tech, product strategy, and career growth right here. And I will see you in the next video.